Here is a comprehensive overview of a stroke rehabilitation program designed to be understood by patients, families, and caregivers. Understanding the Stroke Rehabilitation Program. A stroke rehabilitation program is a coordinated, medically supervised program designed to help an individual recover from a stroke. The primary goal is to help the survivor regain as much independence and quality of life as possible. Rehabilitation does not reverse brain damage, but it helps the brain rewire itself, neuroplasticity, and teaches the survivor new ways to perform tasks. The program is highly personalized based on the part of the brain affected and the specific abilities lost. The core goals of stroke rehabilitation. The program focuses on several key areas: motor skills, regaining strength, coordination, balance, and movement. Gross motor skills, walking, standing, sitting, changing positions. Fine motor skills, using hands for eating, dressing, writing, or using a computer. Activities of daily living, ADLs, relearning self-care skills. Examples: bathing, dressing, grooming, eating, and using the toilet. Communication skills, addressing problems with language, speaking, understanding others, reading, and writing. Cognitive skills, improving thinking and reasoning abilities, memory, attention, problem-solving, and decision-making. Swallowing function, ensuring safe eating and drinking to prevent choking and pneumonia. Emotional and psychological well-being, coping with the emotional challenges of stroke recovery, such as depression, anxiety, and frustration. The multidisciplinary rehabilitation team. A successful rehab program involves a team of specialists working together. The patient and their family are the most important members of this team. Physiatrist, or rehabilitation doctor, leads the team, manages the patient's medical needs, and oversees the overall rehabilitation plan. Physical therapist, PT, focuses on restoring movement, balance, strength, and mobility. They help patients learn to walk, get in and out of a bed or chair, and navigate stairs. Occupational therapist, OT, helps patients relearn the skills needed for daily living, the occupations of life. This includes dressing, cooking, bathing, and using adaptive equipment like grab bars or button hooks to make tasks easier. Speech-language pathologist, SLP, works on communication and swallowing problems. Aphasia, difficulty understanding or producing language. Dysarthria, slurred or slow speech due to muscle weakness. Dysphagia, difficulty swallowing. Neuropsychologist or psychologist addresses cognitive impairments, memory, attention, and emotional issues like depression, anxiety, and post-stroke PTSD. Social worker or case manager helps with discharge planning, coordinating care, navigating insurance, and connecting the family with community resources and support groups. Registered dietitian creates a nutritional plan, especially important if the patient has swallowing difficulties or other health conditions like diabetes. Recreational therapist helps patients return to hobbies and leisure activities they enjoyed before the stroke, adapting them as needed. Key components of a stroke rehab program. Number 1. Physical therapy, PT. Mobility training, practicing walking, gait training, often with assistive devices like walkers or canes. Range of motion exercises to prevent joint stiffness and muscle shortening, contractures. Strengthening exercises, using weights, resistance bands, or body weight to rebuild muscle. Balance and coordination drills to reduce the risk of falls. Constraint-induced movement therapy, CIMT, restraining the unaffected limb to force the use and strengthening of the affected limb. Number 2. Occupational therapy, OT. Self-care training, practicing dressing, bathing, and grooming, often with one hand or adaptive tools. Fine motor skill development, activities like picking up small objects, buttoning, or writing. Home safety assessment, recommending modifications like grab bars, shower seats, or ramps. Cognitive retraining for daily tasks, practicing sequencing steps for activities like cooking or managing medications. Vision therapy, addressing visual field cuts or neglect. Number 3. Speech-language pathology, SLP. Language therapy, exercises to improve word finding, sentence formation, and comprehension. Speech drills, articulation exercises to improve clarity of speech. Swallowing therapy, or dysphagia therapy, exercises to strengthen swallowing muscles. Learning safe swallowing techniques, like a chin tuck. Diet modification, example, thickened liquids or pureed foods to prevent aspiration. Cognitive communication therapy, working on memory, attention, and problem-solving skills as they relate to communication. Where does rehabilitation happen? The setting depends on the severity of the stroke and the patient's needs. Inpatient Rehabilitation Facility, IRF, the most intensive option. Patients receive at least 3 hours of therapy each day, 5 days a week. They live at the facility and have 24/7 medical and nursing care. This is for patients who are medically stable but need comprehensive therapy. Skilled Nursing Facility, SNF, is a less intensive option than an IRF, provides therapy but at a slower pace, like 1 to 2 hours per day, suitable for patients who cannot tolerate the intensity of an IRF. Outpatient Rehabilitation Clinic. The patient lives at home and travels to a clinic for therapy sessions several times a week. Home-based rehabilitation. Therapists come to the patient's home. This is ideal for those with limited mobility and allows them to practice skills in their own environment. The recovery timeline and what to expect. Recovery is a marathon, not a sprint. Every stroke and every recovery is unique. The first 3 months. This is often the period of fastest recovery as the brain heals. Intensive therapy is crucial during this time. 3 to 6 months. Improvement continues, though sometimes at a slower pace. The focus is on refining skills and increasing independence. Beyond 6 months. Meaningful progress can continue for years after a stroke. The brain's ability to adapt, neuroplasticity, doesn't stop. The focus may shift to community reintegration, returning to work or hobbies, and long-term wellness. Advice for patients and caregivers. Be an active participant, ask questions, and be involved in setting goals. Your motivation is a key driver of success. Celebrate small victories. Recovery is made up of many small steps. Acknowledge and celebrate every bit of progress. Prevent caregiver burnout. Caregivers must take care of their own physical and mental health. Seek support from family, friends, or support groups. Stay positive but realistic. Hope is essential, but it's also important to understand there will be good days and bad days. Practice, practice, practice. Repetition is how the brain relearns skills. Do the homework your therapists assign. Join a support group. Connecting with other stroke survivors and caregivers can provide invaluable emotional support and practical advice. Disclaimer: this information is for educational purposes only and is not a substitute for professional medical advice. A stroke is a medical emergency. Always consult with a qualified healthcare provider for diagnosis and treatment.